Hello everyone, my name is Ashish Rai, Assistant Professor, RPIIT Institute of Pharmacy. Today my topic is about the treatment strategies of IBS, that is irritable bowel syndrome. It involves the mix of drug, diet and psychological intervention. Dietary modification: avoid food that trigger symptoms like gases formation, lentils, legumes and beans, and food made like fermentable oligodein, monosaccharides and polyols are short chain carbohydrates. Polyols is intestine. Fiber supplementation may improve symptoms of constipation and diarrhea. The pharmacological therapies are antispasmodic, dicyclomine, hyoscyamin, peppermint oil, mebubrine, and pinavarium, and tricyclic antidepressant like amitriptyline, nortriptyline, and selective serotonin inhibitors. Reuptake inhibitors, fluoxetine can be given, citalopram can be given, and drugs for IBS are laxatives, that is psyllium husk, and chloride channel activator like lubiprostone, serotonin agonist, and guanylate cyclase agonist. And drug for IBSD is antibiotics, rifaximin, loperamide, and serotonin antagonist are sildenafil. And antispasmodic is used mostly for short-term relief of abdominal pain, but also treat diarrhea in patients with IBSD, iodine dicyclomine, and other drugs. Anxiolytics can be given, and mepebrine can be given, and pinavarium can be given. Tricyclic antidepressant is also a mode of cure for IBS, that is imipramine, amitriptyline, nortriptyline, and selective serotonin can be given. And laxatives, chloride channel activator, serotonin antagonist are the drugs of choice for IBS. Thank you.